So, you know what? Without further ado, let me tell you who you are and maybe explain a little bit about what we're doing here tonight. I'm Dr. Maureen Hayes from Galveston, Texas, and I'm joined by my regular partners, Jim and Ann Glenn from San Antonio, Texas. Jim is our big money man, and Ann is our personal trainer and nutritionist. And of course, we have Dr. Lee Osler from Washington State, dentist extraordinaire and author of several books on Redox, including Redox Matters, which is also the website where you can see recordings of these webinars. So redoxmatters.com, go there, check out Dr. Lee's books. They're phenomenal. And also look at the archived videos there on all sorts of subjects with all sorts of different medical professionals and some other people, some of the leaders in the field. So tonight we have a fan favorite on, Dr. Ed De La Reyes is on from Kentucky, aren't you, Dr. Ed? Is that where you
Yes.
from? Originally from the Philippines. And he's going to regale us. He's got some phenomenal stories. And what I really love and appreciate is he has a background. I was laughing because I'm an anesthesiologist and pain specialist, married to a pediatric anesthesiologist and stem cell researcher. Dr. De La Reyes is a pediatrician, anesthesiologist, and pain specialist. So he's kind of like me and my husband all in one package.
Yeah.
Pretty amazing. Pretty amazing.
Yeah.
So wonderful. So just like my husband and me, 13 years ago, we got in, and I think you're a little bit behind us, right? About 11 years now, Dr. Ed. And,
No, this since 2017.
oh, not even. So about 8 years now.
Yeah.
What's interesting is we have a lot of healthcare practitioners who are involved with our company now, and we all come in very skeptical and maybe even a little bit cynical about salt water from Salt Lake City. Most of us are not familiar with this product, so if you've never heard of it before, this is your first time to be introduced to it, don't feel bad because most of us had not heard of it either. What these are, this is a technology that actually makes these bioidentical molecules that are made in every cell of our body outside of the body in a solution where they are stable until they're ingested or touch organic matter, and then they go to work. All this is a bioreplenishment agent that we use that actually causes enhanced healing, increased athletic performance, reverse ages because it makes the cells act like they're much younger. So we see people get incredible health benefits from this, as well as having their body function because their cells are functioning better. So without further ado, I'm going to ask Dr. Ed to come on, tell us, Ed, how you got introduced to this. And you've got a number of different stories, kind of 3 generations of stories to talk about, and some photos to show us as well. So I'm going to hand it over
Maureen. Real quick, can we go ahead and have Lee go ahead and do the disclaimer because of some of the photos that are going to come up? And then should we go ahead and either have Dr. Ed or Lee kind of explain what these molecules are?
Why don't you explain what they are, Jim?
You talking to me?
Yeah. Most of the people on here, are what we call lay people, regular people. So it'd be interesting to hear you. We'll have Lee give the disclaimer. And then I'd love to hear how you tell other people what these molecules are, because we want to tell people, we want to have everybody be able to share these with the people that they love and care about. So take it away, Lee. Give the disclaimer.
Well, it's so nice to be on with Dr. Ed. It's like he's a champion. His story is so compelling. He's got such a pretty smile. I love his teeth. I mean, everything works here. So this is awesome.
He's never said that to me.
Yes, that's what they look at.
I know he's probably thinking I see implants in our future.
What can I say, right? Well, we welcome you all on board. We are all independent associates of a company named ASEA Global, based close to Salt Lake City. That's why that previous reference. It is a supplement company producing a supplement that works on our cells, pathway genes, and as such, as a supplement controlled by the FDA in this country and all its equivalents in other countries, we do not make any claims to diagnose, treat, cure, prevent any disease or disorder. It does help cells to work better, and so you're going to hear about that tonight. in Dr. Ed's story, and you're going to see things which are quite amazing, but they're better because we made the cells work better, and that's really the fundamental basis of natural healing. And so, Dr. Jim, you take it away now. You tell us.
Putting me on the spot here. We got introduced to this 11 years ago, and when I first heard my best friend talking about it, I frankly didn't believe it. It's a technology made from, as Alan Noble says, the most humble, whatever it is on the planet, which is salt water. And when I heard that, it was a head scratcher. But when I saw what it did to my best friend's son, who got hit with a bug on a cruise ship and was literally paralyzed within a matter of days, and they gave him 2 years to live. And they started drinking these molecules that replicate exactly what's happening inside my body right now and inside everybody watching right now, inside every cell, as I say. And these molecules read the genes in our DNA, and then the DNA tell them what to go do. And if there's any work that needs to be done, any kind of protection, any kind of detection, and any kind of repair, these molecules do it. And they read everything. They can, like Dr. Osler has said, it's like little thermostats for everything that our body needs are inside every cell. And these molecules fix that God's way. So to me, it's a divine intervention that we received 16 years ago by one of the most miraculous men on the planet, Vertus Norton. And we have a true gift. And, you know, Maureen, it's interesting. The reason we started this show over 7 years ago, is that I wanted to keep myself in front of people like Dr. Ed and Dr. Maureen and Dr. Lee. I needed to hear the stories, because what you're going to hear is going to sound absolutely like it's not possible. But it is. And I just challenge everyone, do your due diligence, listen to the show, listen to Dr. Ed and Dr. Lee and Dr. Maureen. Because what we have is the biggest thing to ever hit the market. I'm an ex-stockbroker. There's nothing bigger than this on the planet. There's no IPO, initial public offering, that could touch what we have. So please listen attentively and get back to the person that got you on the call and get started and watch what happens to you. That's my story.
That was great.
Dr. Ed De Los Reyes.
Thank you again.
I love your story because you and I have some of this in and when I saw these pictures, I started to hurt all over again. I had nightmares real briefly because it brings back some really not very good memories for me. Because I think you and I have a very similar story. So please take it away.
Well, thank you again for bringing me in. I'm always honored to be in this panel. It's a panel that is full of wisdom, full of knowledge clinically, and the research that Dr. Lee has been doing continuously, while you guys help us in the field with the science of it. And I could not add more about that one. I'm here to really not to do some more knowledge and wisdom. You have it all. I'm just here because of my personal experience about this technology that affected my life positively, my mom, my wife, and my grandchildren, and a lot of my friends. And this is why I'm here again, and then telling my story about these things. I've been trying to describe what happened to me and all these things. I think I asked a permission if I could just show it. Pictures would always tell us a great description than my own words. I just passed my ESL. English is my second language, and that's why let me bring in these pictures and show it to you. To get started, I was introduced to this biotech product or agent, that the replenishment agent, about in 2017, really 16, end of 16, about December. But I regularly use it now in 2017. But let me just share a picture about this thing, and it's gone. And there you go. Oh. Oops.
Oops, went bye-bye, huh?
Yeah, it went bye-bye. Well, let me just
Zoom is getting kind of complicated.
I
and
I had the
know.
same thing happen the other
yeah,
day.
it has a lot of changes.
So there's a green button down below where you hit share. Can you
Yeah,
do you
and
see the green button? If you move your mouse, you'll see the green button show up with an up arrow.
yeah, I found it. And
Okay.
if I could, there you go. Sure.
And while Dr. Ed is looking for that, let us reiterate that even though you've got a number of medical professionals on this, we're not here to diagnose, treat, cure, prevent anything. We use these molecules again to help the cells do their job better, which enhances some of the functions in the body, including healing. So take it away, Dr. Ed.
Okay,
And then
yeah.
we'll have Lee come back after and share why that's the case. Go ahead, Doctor. I'm sorry.
Again, to give emphasis to it, this is just my personal experience. I'm not promoting anything about this one, but this is what happens when I was taken away from disability to functionality, and so what happened to me is in 2015. Let me just play these things in that way you could understand.
That's post surgery. How many days?
Yes, this is just one day post surgery.
1 day. Okay.
Yeah, that it's kind of late night, maybe 12 hours after surgery. They let me out,
See those teeth? Did you see those teeth? You were smiling.
No. Yeah, and I was crying, and that's why I can't believe you had that cotton picking smile on your face when I was in tears.
Thanks for the teeth. I have a sister that's a dentist, so this is her work.
Now, again, this is a year, whatever. This is before ASEA.
Yeah, the why I show this one and what is significant about this video is that I remained this way for over a year, for
Oh.
14 months, and supposedly, so my story started way back in 2015, after a long flight attending my son's wedding. I came home with a severe discomfort from the back going down to the right foot. I kind of it's within my specialty. I know what it is. So the very next day, I went and have it imaged, and of course, right after that, just a few minutes that this radiologist read it, he called me and he said that you need to see a neurosurgeon as soon as you can. So I said, okay, I have a friend, neurosurgeon, that I could just call. I told him, and then he right away fish out the imaging and said, well, you need to have it done as soon as you can. And I resisted that. I said, no. And so let me just talk to somebody else. I don't believe you. You're just my friend. You're recommending this thing. So it took about about a total of six more neurosurgeons and spine surgeons that I consulted, and all of them recommended that I need to have this thing done, like a procedure to be done. So I know it's my within my specialty, so I know where to go. I elected to go to Philadelphia. I have a cousin there who is one of part of their practice, and he recommended the guy that's the best among the 65 neurosurgeons and spine surgeons who does these things. In fact, his specialty is putting football players, professional football players, back to play. And I said, well, I was confident I'm gonna get well with this one, so I did. And my cousin said he has a 90% success rate, and he's really, really good. So I did have my surgery, and that was post-op day one. And what happened then is I belonged to the 10% failure. So instead of getting better, I gotten worse. So in short, I became a patient of my own specialty. And so my specialty is interventional pain management, chronic pain management. And so I write these prescriptions that was given to me. I was given five, and then three of those are controlled, and one long acting, one short acting, one for sleep. And then I was given this neuromodulant that normally is given 100 milligrams BID, but this was, I have 900 milligrams 3 times a day. And that's just to confuse my brain that I don't have discomfort. So, but in spite of all these things that was done to me, I still could not sleep at night. Every hour, this discomfort would wake me up. So after sleeping, so you try to be comfortable, you go doze up before even an hour, it wakes you up. It's just like in the back, hey, and then the severe discomfort comes in. So I have to change position. And this is every hour, this is the way. Now, this lasted for over a year, that every day, this is my life. Until that time, and of course, when I have my follow up, I go to Philly and followed up.
Hey, Ed,
Yes,
what did that do to you mentally? I mean, to deal with that every day for a year,
yes.
that starts to affect you all over the place.
Definitely. That's why during my yearly follow up, I already became depressed. So my physical health went, and then after a year, my mental health went. So with that, no more thinking. My thoughts at that time is that, you know what, give me a knife. I'll do it myself. Open my back, let this monster come out. And I said, yes, let's do this. Let's do this second back procedure that you've been offering since I had these things done, and I have no problem with that now. And so I agreed. And what was working with me was it took 2.5 months so that I could have a schedule. His and mine schedule would work, and then we'll do it. So it was at this time that I was introduced to ASEA. And it's just my brother-in-law that introduced it to me. He is yes, Jim.
Ed, were you able to work during that period of time? Did you have to take off?
No,
Were you able to function?
yes. The thing is, I was told after that back procedure that I have that I could no longer work. So yes, and I told him, you know what, just sign me off. I'll take care of myself. I take responsibility, and I work. So that's why I said I have to use this walker to go to my workplace, and then when I make rounds for my for this patient, do my pre-ops, do my post-ops. I'm glad that there are some kind of side railings in the hospital, and that's where I hold, because I don't want to be seen by my patients on the walker. So I hold onto that side railings. Maureen would identify this. These are just really protectors of stretchers and beds that would bump into walls, and I hold to that from floor to floor, and that's how I did. So I was a partner of the practice, so I could choose what I do, and so I continued to work that way. So I was just making the schedule for the day instead of really doing my thing, and then I dropped the my pain practice because that would require me to wear a 20-pound jacket. I can no longer do that because all of our procedures are done under fluoro. And so I just there doing scheduling. And on occasion, I would cover and I would supervise CRNAs. These are pretty veteran CRNAs. They really don't need supervision, but that's it. They just put my name there. So I was able to survive for that much time, continuing to work really because I was not expecting it. I was not ready for it. I was in the height of my practice, doing all this stuff. I was glad I was able to help, and then so I was brought in from Washington D.C. to help their pain practice, who was just doing 6 procedures a day, and we built it up to 40 procedures a day, and then from 1 clinic to 6 clinics. So pretty good. I feel pretty good about that. And then so I didn't want to give up on it. And so I continued and I can work with it. But yes, at the end of it, after a year, my mental capacity was gone. I could just not say, you know what, just give me a knife, I'll do it myself. But that just was it. I agreed to it. So my brother-in-law comes in. He said he has a good effect with his wife, being a diabetic and asthmatic, and then but they heard that it's good for my condition. So introduced it to me, and at that time I said, okay. But culturally, we respect our brother-in-laws, especially that they are our older brother-in-laws, and so we respect. And I had no questions. I said, "Okay, I'm gonna try it," but in my mind, 100%, this is not gonna work because all the meds that I write with my 30 years that I've been writing it did not work. How much more for this? But out of respect, say, all right, I'm gonna drink it. I'm gonna apply these things and let's get done with this. So I could just tell him I did it and it's gone. To my surprise, though, in drinking this and in applying the gel in my back, after 5 days, I had the best sleep I ever had.
How
That's,
much were you drinking, Dr. Ed? And
you
how
know,
many times a day were you applying the gel?
yes, I was just drinking twice a day with just 1 cup. And then I applied this gel 3 times a day.
Okay, so
So
1 cup is 2 ounces. So that was 4 ounces a day.
4 ounces a day.
Okay.
And then because at that time a monthly box was just for four bottles, and then I have a gel. So that was just the only thing I was using. But with even with that, my pain, my discomfort level from a 10 to die a 6. So my most severe one was was 10, and then it came down to 6. It was heaven for me to be able to do that. And with that, I was able to discontinue the walker. And with that level, I was able to discontinue the medications that I've been on gradually, slowly, and things. And the good thing about it is it was 2.5 months, is I waited days before I called my surgeon to call off the procedure. So I was able also to cancel that second back surgery. So I was alive. That was a life that was changed. I was happy about it. And then from being said, from thinking 100% this is not going to work, to now says, oh my the good Lord has answered my prayers really. And then from that to a placebo effect, this is 100% placebo effect, and did that thing. So that was I was happy about it, but I also want to share it to my mom, that my mom can have a good sleep and my mom can have a good energy, because at that time she was 90 years old, and 4 years previous to that she had a brain condition that not allow her to speak anymore, and she's not able to move on the right side, and she's 90, and she's I said, let's just give this to mom. And so I have to talk to my 5 other siblings, and so all of them agree. Okay, let's do these things, and those are the only things that I want. And then of course she had that good sleep. Of course she had that good energy. But what was surprising to me, less than 2 weeks time after she started this, and of course, these recommendations I did was just the same thing as me, because at that time I was still drinking 1 cup twice a day and then applying gel wherever she has discomfort.
Ed,
Yes,
how long was your mother that way? How long was she affected?
4 years.
How long?
Four.
4 years?
For 4 years. And that's the one
Wow.
that really surprised me when she started speaking again, first in words, then phrases, then back to conversation. That surprised me. I could not explain it in my own traditional knowledge of medicine. So that caught my attention. I did research. I called on PubMed. I researched in PubMed. At that time, there's already more than 200,000 articles about redox signaling molecules. But the significant thing that really uh, happened to me was I met the medical atomic physicist that stabilized these molecules. And from him, I was able to discuss a lot of studies that he reviewed himself before stabilizing these molecules. So I was so intrigued about all this conditions, the studies that they have, and one that caught my attention because within my specialty is that they were going to make it as a surgical wash. because it has this antimicrobial thing, and then at the same time it promotes cellular healing. So our surgical wash in the operating room is just purely antibiotics. That's all. It's just antibacterial, and that's what we have. This
Hey,
was
Maureen, have you ever seen something like that before? I mean, you guys are similar with him drinking, because that doesn't happen to everybody. I mean, can you maybe touch on that real quick, Maureen? That people don't drinking 4 ounces a day, and with the degree of where his discomfort was, doesn't happen that way all the time. Can you maybe touch on that?
Sure. It makes everything you do for yourself work better. So, Dr. Ed was also taking medication. So you may have actually been getting a better effect from his medication too. It's kind of like I describe it to people, kind of like changing your lifestyle. If you're on medication, maybe for your blood sugar or your blood pressure, and suddenly you adopt a very healthy diet and healthy exercise program, you may over time be able to back off some of those things because they start to work better. Your body is working better, it's responding better. So I would imagine that Dr. Ed probably had a very healthy lifestyle. And so when he added, it was like the missing link. That's what we found in our own study. With my husband's health and even with some things that happened with me and other members of the family, it was like it wasn't until we added the Redox that everything else we were doing started to really work well. Now, I think what you're referring to is the 2 ounces twice a day. A lot of times, what I have experienced, I think others, Dr. Ed, Dr. Lee, you can jump in here too, is that there seems to be a volume versus time kind of gradient with this. So if you're over the age of 45 or 50, I like actually for people to take more so that they get a better benefit and they get the effects faster. Now, there's no problem with taking 2 ounces twice a day, but you may have to wait up to 90 days. And now, with the new studies that we're seeing, we see that the real effects are between 60 and 120 days. So we really have to ask people to stay on it longer. But what we find is that if you increase that amount that they're taking from 4 ounces a day to maybe 8 ounces a day, so you double up on it at least for their first month or more till they really start feeling the effects of it, they will get those effects faster. That is, my experience and the experience of a lot of other people. So there's no problem with taking 2 ounces twice a day. You just have to be more patient. If you want the effects faster, then you can take more, and it's 100% non-toxic. So it's not like any of the medications that Dr. Ed or I wrote over decades that all came with side effects, some of them with warnings. I'm laughing because he's on all 5 medications. I could probably name them for you. And then you start to have to give medications for the side effects of the medications that you have them on. It's just a catch-22. And here we have something so simple. And not only what it did for you, Dr. Ed, but for your mother. That's amazing. So, you literally got your mom back. So back to you, because I know.
Hey, real quick, I want Lee to kind of hit on, Lee, do these molecules have to work because of the rules, as you say, the rules of the body, the rules of the cell? So even maybe if he didn't feel it, was it still working?
Well, yeah,
Lee?
we get kind of caught up in the idea that I have to feel something in order to be able to judge that something works.
Right.
That's a very that's a very mainstream medical mindset. It's a reductionist mindset, 1-to-1. And then when it doesn't work, then we're searching for the next drug or the next something, to get the effect, which we are, in this case, measuring by levels or degrees of discomfort or lack of discomfort. But at the cellular level, even if we could probably hypothesize, what if the discomfort never changed? The argument would be, is it doing is it helping the cells be healthy? And when you peel the onion down to that layer and understand the effect of pathway genes on DNA and on protein creation, it's like I go back to what Dr. Marine just mentioned with the 60 to 100 days. We're starting to get some some data that is confirming what we always suspected observationally, that we're seeing reductions in inflammatory response happen in a time, and I think perhaps a dose related way or an amount related way, because of the effect that these molecules have on the switches that turn on the survival and longevity genes inside the cell. These are the processes in the cell that clean out the garbage, that create DNA protection, that produce antioxidants, that shut down the inflammatory response. And whether or not I'm feeling it or not feeling it, those things are happening in the background. The truth is, for most of us, observationally, we see the effect of improved discomfort. One of the things I've noticed in the years I've been here is that one of the most common observations that we have is an improvement in comfort levels, in mental cognition, in processing. And it's simply because the cells are working better. They're taking the garbage out. They're dealing with oxidants better. And the net effect of that is I'm reducing the inflammatory response systemically throughout the whole body. I'm lowering the whole body burden of inflammatory burden. And that's reflected, then I feel better, which is what happens. And I see that's what Dr. Ed's describing, in his observation here.
Now, Dr. Ed, back to you. That the fact that it took your mother having that amazing, life-changing, that was when you started to believe that these molecules were working? It took that?
Yes, for me, it was just a placebo thing, and it's still me. I just I didn't even bother to know about it. It's an answered prayer for me, for myself, but when it worked on moms, and I could not explain it, I said, I need to know more about this thing. I need to just, what is this? And so PubMed, a lot of articles, CNS, and all those kinds of things. And then medical atomic physicists just says these are the things that they reviewed and reviewed. I said, wow, what are these things? And then I just recommended it to friends, because this is just cellular healing. It only works in one thing, and it only works in cells. And if it's the problem that they're asking me is about cellular abnormality, I said, you know what? Try this. It worked on me in this condition. It worked on my mom on this condition. It worked on my wife's in this condition, and try it. And that's how I became an associate, because I recommended it to a friend, and who was just asking a referral for a surgeon that's gonna fix the shoulder, because it was already time to do that procedure. He had physical therapy, he had chiropractic manipulations, he has all things done, and still did not do it. So I said, you know what? I was not sharing. I was just a customer, and I really did not want to do that. And until this one was, and I said, you know what? Try this, because it did to my back. It did to that discomfort that runs to my right foot. And then just try this one.
Can you dig a little bit deeper on that, Ed? That you knew that this was being distributed through word of mouth marketing, correct? Because that's how you heard about it, was your non-medical brother-in-law. Yes. But what was it that maybe switched, in that you saw that it worked on you, your mother, and others, so others deserve to hear about it? I'm assuming that's kind of, with our belief, I know we're common in that, we kind of like, they deserve to hear about it, right?
Yes, and so from that being a customer, and I thought this was just really the good Lord has just favored us and my family, and then this was the first neighbor of ours that I recommended, and then called me after using the gel and after drinking, that what is this stuff? He could already raise his shoulder and had with no discomfort at all. That was in 2017. Until now, still didn't have the procedure done, and still continuously do it. And in fact, they're platinums. They're the great encouragements for us why we do it, because they keep after that they just could not stop talking about it and talking about it, and that encouraged me to say, you know what, we could do this. We could be we could be an associate and then and help people this way even much better. And so that was my beginning of becoming a member, not just a customer.
Mhm.
And then so I shared and I shared, and because truthfully and honestly, it is something different really from what I am used to in traditionally writing scripts and writing scripts. And then I have a lot more things that I've seen side effects of a lot of these things that what I do. And then also for 30 years, I'm pretty sure I contributed to a lot of kidney transplant and liver transplantations. But of course, we're protected from those fine prints, really, that what we write. And then, but becoming a patient of your own specialty, being given the very kind of medications that you've been writing for 30 years, and being taken from disability to functionality by a method that you really was skeptical about, that you really did not believe, and all of a sudden this was, and you were able to get off of those things that you were doing, and then that was in 2017, 16, and now I'm continuing to do that. I'm not on any meds for doing this continuously, and then I'm functioning even much better than I was functioning before I got that condition. And to even affect other systems that I have an abnormality. Like 6 months after I do this, it kind of it it showed an abnormality of my cardiovascular system. I did not tell this Redox that, you know what, I have another one that maybe you could fix. And
Yeah.
this is I had uncontrolled blood pressure issues. And for more, since residency, I had this one. My cardiologist, my primary care physician, I myself could not take care of it. I was on 4 meds, and I said, you know what? You're not stroking. You're not having a heart attack. 150 over 100 is good enough. I said, yes, that's good enough. 4 meds is I don't want to add anymore. And I was living that way. And all of a sudden, 6 months after just taking this, you have relief of it. I said, what is this voodoo? That from 4 meds, I'm taking only one, and I'm only taking it for myself because I'm still a traditional medical practitioner. If you are on a maintenance drug, you're going to be on maintenance drugs for your life. I'm just doing it because, of course, we get stresses and sometimes, and our pressure goes up and down occasionally. But I'm just taking that for that matter. But for years, for 30 years, three of us cannot manage to take care of it. And this one, because you just put it in your body and you just let the normal body structure, the normal created cells and created system of our great intelligent creator that did it, now would just do it by itself, would find these things that needed to be fixed. And I was just drinking it for this discomfort that I have on the back. But these molecules went into a system that said, oh, this needs fixing. You know what? There's something in you that's not communicating well. That's why your vasculature is just constantly constricted. And reestablishing that communication from what it was made for just relax the whole thing. And I got this relief and that way. And I'm telling these testimonials and years and years and years after, I'm 71 years old. I'm supposed to be taking more maintenance medications, but on a yearly basis, I'm just taking it all off and off and off. Signing off is I'm just from 4 meds of blood pressure to just one, from this dose of cholesterol medications to half the dose of it. and it's a pretty exciting journey that we are, and my wife is the same way, and we're enjoying just these things and doing that, and I'm enjoying sharing it and helping people that there's something really that would let our created bodies, which is very intelligent, it has amazing intelligence in it, and just letting that do by itself, and just replenishing these things. And the reason why I went into that effect, because I kind of physically abused my body, and that caused a lot of physical stress to it. And then, of course, with the kind of work that we do with Maureen and I, we have a lot of stresses physically and psychologically when we have difficult cases, our AAC 4 and 5 that we do. And this throws off the redox environment that you have. And it should be balanced, and it becomes unbalanced, and it's not checked. And it keeps on doing that, and nothing has checked it. And all you got to do now is we have these things that can check these things on a cellular level, and then we write scripts, and we deal with receptors. We want it to stop or we want it to enhance, and that's what we do with our writing things. But here, you just put it in your system, you let it run through, it will find things, it will reestablish signaling, it will check things, and it will initiate repair. And if you cannot repair it, it initiates replenishment, and it just makes your whole system work much better. And
Well, and the key point there is going to find things that you don't know are even wrong.
exactly, and that is what the thing is. And I wasn't aware that it was good for this cardiovascular thing, and I was like, forever you're just going to be that way. And my cardiologist was good. He really has a good practice, has a good training, and everything, but he wasn't able to do it. My family practitioner was unable to do it, and me too. And then all of a sudden, here's something that you just put it in, and then it just detects, it just do its natural play on how the cells would work. And it's just providing, you make it imbalance, that redox oxidation, that reduction oxidation reactions that we needed to be balanced. And then it has to be balanced, because if it imbalanced, then we're off, and then we're off for years and years and years, and then it develops into a disease process that it's not checked. And then we go to the traditional way of how we're going to do it. Is that, you know what, let's fix it. It's tight, it stinks, it makes it relax by, hey, I'm going to do this receptor here, I'm going to do this calcium receptors, I'm going to do this other receptors, I'm going to take care of that, and let's see if it's going to relax. I got 4 of those receptors that is doing stuff, and it did not work. I still have this high, and all of a sudden, we have this, and those 4 receptors that we blocked by those things that we prescribed, and it did not do it. And then here it comes. You're just providing really electrons for this reduction oxidation processes, and just make it balanced. And all of a sudden, there's proper communication. That communicating with these receptors, and then I'm able to discontinue those things, and I'm still the same way of normalization of my pressures. Yes.
Well, I had a couple quick questions. So did you have brain fog? Were you able to, as soon as you got better, you weaned yourself off? I know Jim did that, and he saw brain fog lift. Did you see that same thing by weaning off of those high dose?
In fact, the first effect, when I have a good sleep, so that brain fog was on, that depression was off. But even when I was able to discontinue those meds that I have, of course, I have to gradually even do that
under medical care, correct?
Yes, and then and let go of those things is. I said, that's why I said this is functionality.
Yeah.
Normalcy. and from disability to functionality, now to be back to normal. I said I could tell people about this. I
Right.
could just share
Well,
this.
we owe it to them to share it,
Yeah.
frankly.
Yeah.
Now,
We'd like to-
what about your mom? Did she, what kind of things did you see change? Someone else gave her the Redox each day since she didn't have I assume she didn't have the cognitive to do it herself.
Yes.
Did you, what kind of things did y'all see in the first week or month or?
She was back with us, and then although she could not still move, I think she might, I don't know, but just my siblings were resisting about an increase in dose. So that was the kind of thing that we debated upon. But when she had this for 4 years, she was just staring in the air. She could not. When we go there, we kind of catch her attention. Hey, mom, this is Ed. I'm here, and I'm here visiting you. Those are the kinds of things she would look at you, but there's not kind of reaction. When she was back and she was talking again, her smiles is back, and her counting her whatever she has is back, and says, "Oh, make sure you guys don't touch these things. Make sure you don't do these things." Those things are back, and for 4 years you lost her, and now she's back with that kind of things. That is pretty impressive that I experienced. But all right, and let me continue.
Awesome.
I have one more that
Yeah,
really.
Yeah.
I was gonna say, where's the
Well,
fingers?
Lee was talking about peeling back the onion. Your wife actually peeled off some skin.
Bad. Yes.
Warren,
So if you have a jittery stomach or a,
you don't like red.
yeah, go ahead, Lee. Go ahead and give another disclaimer here, Lee, please.
This is, we're going to show you some graphic pictures, so you've been forewarned that you can shield your eyes or look away.
Maureen, if you need to cover your eyes, go ahead, Maureen. You're not used to this stuff. I know.
Right.
Lee, you either.
Grimace. She had the red cup.
I see gut and bloods every day. So
Oh.
I know.
the point here,
Maureen, you probably don't miss seeing that stuff, do you?
Oh, it doesn't bother me at all. I'm just wondering why a dentist is seeing guts.
you know,
Oh.
We'll
blood
have
and
to hear
guts
more
is
about
part
that
of
later.
that's part of our business, right? I deal with the gut tract, right? So,
Oh, that's right. Yeah.
Yeah, that's true.
but anyway, we're not showing you these pictures to illustrate treatment. This is about cells working better that makes things work better.
Go ahead and hit the play on that, Dr. Ed. Yeah, there you go. Make it bigger.
Yeah,
There you
this is the thing I have to share it because I could not explain it. I think the last time I did it, I tried to explain it on my own words, but it's hard. And I'd rather, to be fair to all of you, I'd rather show the picture. And so this is what it happened. So I retired in 2017 because I prepared myself to be in the wheelchair after accepting to have a second back procedure. And why I do that one? Because in my practice, most of my patients that have more than one back procedure ends up in a wheelchair, especially with instrumentation of metal rods and bone plates and metal screws. So I anticipated, I agreed to have the procedure done, and I retired. Because I retired, because why? I was already depressed. I just couldn't want to work anymore. I was incentivized after that. I'm going to fight this. So I suffered with a walker on a daily basis, going out there, still being part of the practice, having to do a lot of things. And so finally I retired. And so the good thing is that it didn't go through. I did not have that back procedure. And then being retired, we could hardly afford to do a lot of things that we were enjoying before. One of those is a landscaper. So I did my own landscaping. I trimmed this bushes outside and did that one. So after the work, I told my wife, it's the final say was her. She looked at it. I said, "Oh, what did you do with these bushes and everything?" So she had to redo it. She redid it, and she had this accident. It's an electric trimmer, got caught, her fingers got caught. And at that time, we're already seasoned Redox users. We live by it and we function by it. And so I said, "Oh, this is cellular healing. Let me do these things." And aside from that, it has that antibacterial effect on that and cellular healing. So it was spurting with Bod. And right after that, this is what happened. I soak it and I said, this is going to be saying, let me just take some pictures here and to prove something and see if this is really real, whatever I heard. So this is what we did. And of course, that is the injury on the front and back. And then we went to the ER and this is what happened. That injury went down to the bone. And of course, they have to fix it, suture it, and we were told that, you know what, there's injury to the nail bed and there's injury to the nail matrix. What it means is that this fingernail will never heal again. And will never be in the same form, will never be normalized because of those violations. And so, and the ER physician said, you know what? I apologize. I forgot to remove the fingernail. Anyway, you're going to have an appointment tomorrow with your orthopedic surgeon. So he's going to do it for us. So this happened like late in the afternoon, and then our appointment the next day with the orthopedics is in the morning. So this is about 12 hours, and this is what happened. We just soak it this one with that water, with the sea water, and then put the Renew 28. But look at this as compared to the other side. You could see the base of these things is already approximating, and then this one. Look at that injury there. The matrix is beyond that. And then the next day.
Now, what do you mean the matrix? I'm not a doctor. What do you mean?
Okay. So the nail bed, there is a matrix underneath that is like generating where the nail comes from, the growth of the nails that's being produced. And then nail bed with it. But I was told by the ER physician, if that's violated, that violation will be permanently damaged. So that form of that fingernail will be permanently deformed. So that's what it is. Less than 12 hours. 12 hours. And then the orthopedic surgeon looked at it. I said, I'm not going to remove that fingernail. It's intact in the base. I showed him these things, and he said, I don't know what it is, but I'm not going to remove it. And this is what, of course, that's the promised deformity. 4 months, 6 months after, this is what happened. 3 months, 4 months, 6 months, it returned to normal. It is just normal as it could be. There is no trace of deformity. The nail bed, which was the framework of the nail coming out, and then it just restored. And when you put this supplement into you provide these molecules into your own body, and it will know what to do in the body. It will restore signaling. It will restore the way things are going to be repaired, and it did. It did on my condition. It did on my wife's condition. It did on my mom's condition. And what else did we do about these things except to have this? But these are just, I'm not recommending this really for treatment, but this is my personal experience that I just want everybody to know about it. And that's why I'm sharing it. And again, we have a disclaimer. We are not a treatment for anything. What we do is we just provide a buffet really of electrons available so that your imbalance redox environment can be balanced. There's that exchange that some of these molecules would want electrons for them, and some of them would have extra electrons to give back. And this buffet of electrons that you provide is once everybody's fed who needs it, I want one, and then here, take some, and everything is back. It's just gonna go back into its medium of saline solution. That's why we don't do anything else. And the good thing about it, as opposed to what we do, is that we don't interfere with anything. We let this feedback mechanism be intact, and we're not
Yeah.
altering things, and the whole
Yeah.
body works perfectly well, because that's how the good Lord has created this body to be
Yeah.
able
Hey,
to do.
Maureen. Yeah, Maureen, I want to ask you, pretend you're a doctor out there listening to this and you're seeing all this. How would you respond? Maybe Lee, same thing. I mean, it just sounds, really?
Okay.
This is out there. I mean, you guys are all doctors. This sounds crazy. I mean, it really does.
Well,
Until you see the pictures, until you see it. I mean, and by the way, you kind of put chills up my spine, no pun intended. I've had 10 back surgeries. And when you said someone's had, I've had 4 or 9 of them, the 10th one was put in a stimulator in my back. But you kind of put a chill up my spine, and it makes me really appreciate that much more what this is doing for me. So anyway, Maureen, go ahead. I'm sorry.
Well, just a couple of things. I know when we got started, and next month will be 13 years for us, and it sounded ridiculous. I live on an island. We're surrounded by salt water. I didn't think we needed to invest in this magical salt water that was somehow different from Salt Lake City. But, as a critical thinker, and, most of us who are in the medical profession are taught to think critically. And so I had never heard of redox signaling. But interestingly enough, like Dr. Ed said, at that point, there were only about 6,500 references to redox signaling on PubMed. But my medical school had also at that time gotten a $10.5 million NIH grant to study redox signaling in the body, in cardiovascular, diabetes, regenerative, all sorts of things. You name it, they were studying it, but they were studying it in the body, not outside of the body. So I was thinking, okay, does redox signaling actually exist? Well, yes, it does. There were references to it. Just because it had not come across my desk as an anesthesiologist didn't mean that it wasn't out there. I just was not, studying cell biology. So it was real. The question was, if it's real, were those molecules actually, could you reproduce them and put them in a bottle and stabilize them? Well, back then it was a leap of faith. Now we have every batch is certified to have what's called a redox potential. It's like a battery. It tells you kind of what the charge is in there, and that it contains trillions of these molecules that you can then replenish. They're bioidentical to the ones in our body. It's a bioreplenishment agent. So then the question is, if it exists, which it does, and if they are in this bottle, which we now know they are, does it work in the body the same way our naturally occurring ones do? And we now have studies that show the benefits of replenishing these molecules. Like Dr. Ed was saying with the electrons and all, an analogy that I really like is think of it as the electrical system in your house. When you have a plug, it doesn't matter if you plug in a hairdryer or a refrigerator, they're both going to turn on, right? And if you don't have the right voltage going through, you're going to throw some breakers. And so when you replenish this, it's like flipping the breaker or upping the amperage so that you can plug more things in, more things work. So that's an easier analogy to think of if you're not familiar with electron transfers. So in any case, the studies we have show that replenishing this turns on different processes that are beneficial to the body. There's 5 of them. And get to the person who invited you on here. They can send you a copy of the studies. We have a number of studies that are out now that show some pretty amazing things. And the one study that I'm thinking about, the Tart Lab study, that showed there was a benefit to cardiovascular, GI health, immune status, inflammation in the body, and hormone modulation. They found that when they stopped it, and this gets back to what you were saying, Jim, about whether or not you felt it, young, healthy 35-year-olds, and they took it 8 ounces a day for 8 weeks. When they stopped it, after 8 weeks, they went back to baseline. So we know that it does what it does. It works whether you're participating in it or noticing it or not. And it works exactly the way the molecules do in our body. So for critical thinkers, for the physicians out there, the healthcare practitioners, do your own due diligence, do your own case study. Be an N of one. Get on the product, see what it does for you, and see if you don't end up like being Dr. Lee and Dr. Ed and me, where you feel like you have a moral obligation to let other people know about this because it's simple and it's non-toxic and it's powerful.
Terry Latham kept asking us, and this is what I would propose to everyone. What if? What if it's real? This changes everything in health and wellness. Lee, wrap it up real quick, please.
Yeah, this has been a great call. And I, in response to your question about, what other doctors think about this, it's not just the doctors, it's the mindset of the populace. We've all been conditioned and trained to think in terms of intervention. We're healthy until we have a heart attack. But for example, was heart disease, did it just happen, last night at midnight when I had the heart attack at 8 a.m., for example? Or have I had that condition for 5, 10, 15, 20 years, and it finally got to the point where it produced a symptom or a sign? And my point is that we in the healthcare, the traditionally, what we would now say traditionally trained modern system of medicine and healthcare, we're interventionists. We come in after the fact. We wait until there's a problem, and then we provide something that will mostly just deal with the symptoms. We're not fixing anything with those. We're not curing anything with. It's like, does aspirin cure headaches, for example? And it's like, no, it just takes the pain away, but it leaves begging the question, well, why am I having that problem in the first place? And so this is it's a very difficult challenge for people to wrap their minds around, especially if we've been steeped in the concepts of interventionist Western modern medicine. We're going back, and we're not eliminating that. I certainly, if I had a finger problem like that, I was like, I'm really glad there's somebody at the ER to treat it. If I had something else that was acute, I'm really glad that we have people here in our modern medical systems to deal with them. But what that's not really great at is doing chronic things. It's not, and that gets back to really the thing we've not really talked about tonight, but we've intimated the idea of can we do something that would slow down aging? Is this anti-aging? Are we surviving better, in that regard? And I think that we are, which is really, this is kind of a lifestyle adjuvant. It's stimulating all the processes that good lifestyle does, only it kind of like, it accentuates it. It makes it work better because we're restoring the cell's ability to do that. So I repeat what, both my good physician friends here said is, take a good look at it, but be your own test, and don't get too crazy like we all have about. It's like we've got to go find 10,000 studies. I love to know the science. I love to be bulletproof in that regard. But there's a reason why this works, and it's because it makes the cells work better.
Exactly.
Well, and the fact we're in 35 countries as well over 16 years, and patent protected, intellectual properties protected. So, Dr. Ed, thank you so much. This has really been awesome. Thank you. We do want to announce that there's a show every Thursday. Next Thursday will be Alan Noble doing the Discover ASEA. We made mention, someone did, to a new study that's coming out. We will have Hunter Dean on the show the Thursday after. So in 2 weeks, Hunter will be with us going over the allostatic load study, which is way above my pay grade. I'm shocked I even said that. But we will have him on the show to go over that. You don't want to miss it. Come back and see us. Share this. Get back to the one that got you on this webinar. Get on it. Keep asking yourself, what if? Do your due diligence. All the testimonials, all the stories, all the science that we have, it's real. Thank you, guys. God bless. And we will see Alan Noble next Thursday, and we'll be back in 2 weeks. Thank you so much.
Y'all.
I love
This
you
will be
guys.
up at
See you.
Redox Matters within about a couple of hours, correct, Lee?
Yep.
Thank you, guys.
Have a
Bye-bye.
good
Happy Halloween, everybody.
Bye,
Bye.
everybody.
Bye-bye. Thank you.